Nowadays, there are many obese people, especially obese people. Most of them have non-alcoholic fatty liver disease. This happens not only in adults but also in children. In addition, many type 2 diabetics also have non-alcoholic fatty liver disease. If you perform an ultrasound password liver test, you can determine this. But many people, even when they find out they have this problem, do not take it seriously. Especially when the test results show that fatty liver has reduced fat, they do not care because they think that mild means it does not cause obesity and can recover on its own. They don't know that non-alcoholic fatty liver disease is actually a chronic disease. It's a condition. Normally, the fat content in the liver does not exceed 5%. If it is fatty liver, this number ranges from 5% to 10%. If it reaches the level of severe fatty liver, it means that the amount of fat in the liver has exceeded 25%. Fatty liver means that you are basically no longer healthy. Your liver is damaged. It's just that, at the moment, you may not feel the ground. The function can still be maintained. But there are many people who may feel tired. Research finds that approximately 20% to 30% of patients with non-alcoholic fatty liver disease will progress to non-alcoholic steatohepatitis. At this point, although the facility will have a maximum recovery mechanism, if you still do not have an opinion, do not conduct treatment and adjust your lifestyle. The prolonged or dangerous condition can lead to liver evolution. Once it has progressed to this stage, it means you are in business and are on fire. This will destroy the liver cells and affect the functions of the liver. What does cirrhosis mean? It is like when the skin is heavy, the base cannot regenerate new skin but instead forms scar tissue. Scar has no function, it can only cover the wound. Similarly, if the hepatocytes are replaced by motors, the function of the hepatocytes is also lost. If most of the cells are replaced by scar tissue, it is cirrhosis. At this stage, liver function is no longer guaranteed, and the liver begins to weaken dangerously. At that time, the risk of liver cancer is also very high, even life-threatening. I have previously emphasized that obesity, type 2 diabetes, and metabolic syndrome are linked to non-alcoholic fatty liver disease. Aging and a diet high in fructose also contribute to the development of this disease, so people who like to buy sugary foods need to pay special attention. In addition, hormonal disorders are also an influencing factor, such as pituitary dysfunction, hypothyroidism, decreased testosterone in men, decreased estrogen in women, polycystic ovary syndrome, etc. Since these hormones control the body's basic metabolism, an imbalance in them can also cause non-alcoholic fatty liver disease. Another point to note is that if you have obstructive sleep apnea, prolonged hypoxia can increase oxidative stress and stimulate the release of inflammatory factors, thereby promoting the development of non-alcoholic fatty liver disease. People with this condition are often obese. For people of normal weight who still have non-alcoholic fatty liver disease, the cause is often related to a sedentary lifestyle. This also means that their insulin sensitivity is impaired, their body's ability to store fat is reduced, and their risk of cardiovascular disease is significantly increased. So is there any reason for you to not take non-alcoholic fatty liver seriously? This is the warning from the base for you. You still do not have any feedback? How to deal with non-alcoholic fatty liver? I have mentioned many times the importance of education and healthy diet. For example, in the short term, you can control your calorie intake, replace carbohydrates with high-fiber carbohydrates, limit foods containing fructose, and supplement choline from eggs and beef. If fatty liver does not cause sleep apnea or hormonal disorders, you need to treat these primary conditions with the help of a doctor. Currently, there is no specific treatment for non-alcoholic fatty liver disease. Some 2 diabetes medications may help by increasing insulin sensitivity and reducing fat accumulation in the liver. Additionally, some nutrients may be beneficial, and that is today's topic: butyrate salt. Recent research has shown that butyrate supplementation may help improve fatty liver markers. But further, larger studies are needed to determine its effectiveness. Butyrate is a short-chain fatty acid produced when intestinal bacteria ferment indigestible fiber. It helps maintain the liver's protective barrier, controls inflammation, and prevents harmful substances from entering the liver through the liver. The best and safest way to supplement butyrate salt is with a truly plant-based fortifier in the diet, ensuring a variety of vegetable and grain ingredients. Additionally, maintaining a diverse gut microbiome is important. Exposure to nature, gardening, and keeping pets can help improve this microbiome. Regarding the use of functional products containing butyrate salt to improve non-alcoholic fatty liver, I still maintain a level of caution. If you want to use it, make sure to have an assessment and guidance from a medical professional.